Baptist Health Corbin is a 273-bed facility. We serve 8 counties, about 300,000 catchment area. With the huge opiate epidemic in eastern Kentucky, we have several installations in residential opiate addiction treatment facilities.
When I provide service for the Appalachian Children's Home, it is much more secure, safe, and convenient for them. A clinic visit for them would take anywhere from 3 to 4 hours. Even not for the driving, but just the process of the whole thing. And now I can usually see them in under 20 minutes. So it's dramatically different. I saw a patient who had been waiting almost 6 months to get service, and it just was not available. There was no practitioner for them to see. The location was a real problem, and there just were not a lot of providers in that rural area. So, you know, the desperation of having to wait 6 months for treatment, you could just really hear it. And then, you know, we got the patient taken care of, and they improved within 30 days. It was amazing. So when I have a really bad day, that's what I remember.
We started providing behavioral health services almost 4 decades ago, and we decided that we needed an opportunity to go ahead and actually step outside of the 4 walls of a traditional hospital setting. Some of the stories that recently that I've heard about comes from the Appalachian Children's Home, and staff at that facility have talked about how it's really reduced their internal cost with additional staffing having to be incurred in order to transport patients back and forth to a physical location.
My role at Baptist Health is the telemedicine liaison. I work with the telemedicine team in coordinating services for behavioral health with different areas of eastern Kentucky. The process of applying for grants is a process that involves several people. We have grant writers that we've worked with Polycom to develop relationships with, and over time being able to secure those grants. Polycom's assisted us with being able to complete our reports, collect our data, and of course with equipment.
As a telemedicine navigator, I'm kind of the behind-the-scene person. I get in contact with all the patients and our off-site clinics, get all the paperwork together, insurance information, and actually get them on the schedule to ready to be seen. For me, this is a new role. I've been in behavioral health for 10 years, and it is a specialty, you know, and it's a great need for it. But I'm so excited with telemed.
We've primarily focused around behavioral health services and some primary care services. Probably about 20% of our total volume is currently through telehealth. That is significantly up from just a year ago where we were less than 5%. I can foresee probably in the next 5 years to where 80% of our behavioral health medicine could be done via telemedicine in eastern Kentucky, and probably over half of our primary care visits could be done telemedicine at improved outcomes, improved satisfaction between the patients and the providers, and a much reduced cost to our healthcare system.